constitutional right to abortion. Since then, California has worked to present itself as a haven for reproductive rights. Thousands of women from other parts of the country are arriving up and down the Golden State, coming here for help.
And as Fox 40's Karma Dickerson shows us in tonight's Fox 40 Focus, the influx is changing the state of abortion in California.
California. Come for the sunshine, come for the celebrities, come for the abortions? Governor Gavin Newsom doubling down on the promise of a haven for reproductive refugees with billboards like this.
California just launched a brand new resource.
He says they're going up in 7 states that are severely limiting or eliminating abortion access.
Information. If you're traveling to California from another state.
The signs promote abortion.ca.gov, which includes a special section for people from out of state. It's essentially a how-to for accessing abortion services.
Or whether you live here or not.
And women across the country have been taking the Golden State up on the offer. In California, demand for reproductive services has grown since June 24th, the fall of Roe v. Wade. California's closest neighbor to have a dramatic shift in abortion availability, Arizona.
Many people from out of state seeking that abortion care are traveling this very road here, Highway 8, Arizona, into California. In the first few weeks since Roe fell, the closest Planned Parenthood in California saw an 847% increase in patients coming from the Grand Canyon state.
We were forced to make the decision to pause abortion services until there was legal clarity.
Brittany Fontenot is the president and CEO of Planned Parenthood Arizona, and their pause in abortion services went on for 2 months after the fall of Roe, as the group tried to understand whether the state's previous abortion ban, dating back 150 years, would come back into effect.
So what we really focused on was patient navigation, making sure that people in Arizona knew what their options were for safe and legal abortion in places where it remained very clear that abortion was legal, places like California.
For many of them, their closest point of care was about an hour across the state line, here at Planned Parenthood in El Centro.
As the transportation commissioner for this county, I'm particularly concerned because I know the far nooks of this particular county. It can take anywhere up towards 2 hours to get to the healthcare center here in El Centro if you live within this county. Now imagine someone without transportation access in Arizona, Mexicali, here in Calexico.
Raul Ureña, mayor pro tem of neighboring Calexico, about 2 hours east of San Diego, is a former Planned Parenthood staffer and current client. He tells us he has seen the effect of higher demand for abortions on his own healthcare access.
And I've noticed 3 weeks wait time, 4 weeks wait time.
For STD screenings, where months ago the wait would have been closer to 1 to 2 weeks.
It definitely has doubled and deprioritized other patient visits, but understandably so. I mean, this is a crisis that we're facing.
Arizona is currently the only state bordering California with particularly restrictive abortion access. However, that does not mean that Southern California is the only part of the state feeling the impact of increased demand.
We actually have a significant number of our out-of-state patients being served here in Sacramento.
Sacramento's local Planned Parenthood affiliate is Marmonte, covering Northern California from the ocean to the Nevada mountains.
Every time I come in, there's someone from Alabama, there's someone from Texas. There is a story of a person out of state in California. We're now seeing more than double the out-of-state patients, and we're the largest affiliate in the country.
Vice President of Public Affairs Lauren Babb says Planned Parenthood in the Sacramento area took steps to expand their hours and staff in anticipation of the Supreme Court ruling. So they have managed so far to keep up the needs of patients living in and out of the state. But in some cases, the care looks different.
Can this be a telehealth appointment instead so that we have an exam room for an out-of-state patient? Or can we triage more so that they're coming in just to pick up the medications that they need?
Babb says the logistics of treating out-of-state patients can be tricky, with many needing to fly in and out of California on the same day. Meeting their needs can be complicated and stressful. Still, they have a bigger concern when it comes to out-of-state patients.
What keeps us all up at night is the folks that don't come through our doors. There are so many people that don't have resources, don't have extra, money for travel.
A need she suspects is only going to get worse. As more states work to eliminate or more severely restrict the care California is inviting people to get. In Sacramento, Karma Dickerson, Fox 40 News.